You're ready. So, but let's now get into a little bit in terms of you mentioned earlier on, knee replacement. So, we're then thinking the older age group, obviously 20s, 30s, it's not really appropriate for, because they're gonna need another one in their 40s. They're gonna need another one in their 50s. It's just not really a sensible option. I mean, the youngest I've heard of people having knee replacements, I think, is perhaps 40s, but and maybe 50s, but it tends to be 60 and older. Is that fair to say? Yeah.
Yep, indeed.
What's your experience? What's your opinion? What's your there's lots of debates in the industry in terms of should you go with robotic surgery? Should you not? What's your take on robotics?
I think robotics surgery has certainly got a place. The procedure does take a bit longer than the conventional knee replacement. I think there's a lot of focus on alignment, but my personal opinion is that when you use robotics, you need training, the staff need training, and it does take a bit longer. But you probably call me a dinosaur, but there are other methods of management, such as patient-specific instrumentation or patient-specific implantation. So bespoke type, if required. For a standard knee replacement, in the hands of somebody over 45, the process is based mainly at looking at alignment, and there are templates now that you can have preoperatively to ensure you get the right alignment and use the right polyethylene thickness to actually enable the patient to have a successful knee replacement.
Does that involve like CT planning and CT kind of pre?
Yes, it often involves CT planning or even X-ray planning. For the majority, is X-ray planning, where you have a software that allows you to really determine what implants to put into the patient. But we don't rely on just that satellite navigation type of treatment. If it feels right, because of the number we've done over the years, in my case, over 20 years, you have an idea of the alignment because you see it on the table, and you actually arrange the knee motion before you close up. And if the balance is right, then the knee will move as it should.